Good afternoon everyone, my name is Dr. McQuillan from Berkshire Menopause Clinic, and today I'm going to be talking you through progestogens being used as part of HRT, when you may or may not need them and what the different types are. So let's begin. So I have my trusty model here of my womb, my cervix and my ovaries. So what are progestogens? So when we are using HRT, we have estrogen, which predominantly helps us with our symptoms. Anyone with a womb, we need to give progestogens. If we gave estrogen alone, which is what we call unopposed estrogen, then this can potentially thicken our womb lining and lead to endometrial thickness or endometrial hyperplasia, as it's called, or even womb cancer as well. So that's why we give progestogens. The other reason we might give you progestogens is you may have had a hysterectomy. You may have had your womb removed and think, well, therefore I don't need progestogens. However, what you need to check is whether or not there is some residual cervix remaining. The reason being is our cervix is linked to our womb, and therefore there may still be some residual womb tissue that overlaps. The way to know that is we give you a progestogen challenge, and because your cervix is remaining and you've got a vagina here where blood can outflow, once you withdraw that progestogen, you might get a withdrawal or bleed. If that is the case, then that demonstrates that you still have womb lining and we would need to keep giving you progestogens. Another scenario may be that you've had a hysterectomy and the reason you've had it is because you've got extensive endometriosis. Endometriosis is womb lining-like deposits in other areas of the body. It could be that it remains in your uterus, but you may also have some in your pelvis. Now, if you have had a hysterectomy and your womb has been removed, then of course, you may not know whether or not you're getting bleeding in your abdomen from other deposits in the body. So if you're given HRT, this may trigger endometriosis and there is no way of knowing if that's the case. What I always say is that if you've got endometriosis and it's extensive, so it has been shown to be in the pelvis anywhere, then I would continue to give someone progestogens as part of their HRT. So there's some of the reasons of where you may need it, okay? What are the different types? Well, firstly, it depends on the type of HRT. HRT comes in tablets. You may get an estrogen-only tablet. You may get a combined tablet that already has progestogen in it. You may also be on a patch. Again, they come in estrogen-only patches, or you may have a combined patch, which has estrogen and progestogen in it. And then you have things like the spray, the gel. They are types of estrogen, in which case you need progestogen alongside them, as well as if you were having an estrogen-only pill or you were having an estrogen-only patch, you would again need a separate type of progestogen. One thing to be very careful with is when you're using a combined patch or a combined tablet, if you are still having periods or less than 12 months from having periods, you will be given sequential HRT. So that means the progestogen is only provided for half the month. Now, this can be a bit tricky and it's really important you keep an eye on it because the boxes aren't always clear. So you may pull out a patch, but you need to see and you may need to read really closely whether this contains both estrogen and progestogen or just estrogen. Why does that matter? Because we need to ensure that if you're on sequential, you're still getting progestogen for at least half the month to ensure there's enough in your system to protect your womb lining. Again, why do I know this? Because I've had a lot of patients who, for example, got a 3-month supply, they've used up 2 months, ordered another box, but what they're then doing is just using estrogen patch after estrogen patch only, rather than using the combined patch and not getting enough progestogen for that time. So do be careful. So what are the type of different progestogens? You can get what we call body identical progesterone. So progesterone is a natural form. Progestogen means a synthetic form. So body identical progesterone tablets that you can get. It's a capsule and you would take that alongside your estrogen HRT. You can also get synthetic tablets, such include things like medroxyprogesterone and northisterone. Now, these hold a slightly higher risk of things like clots, for things like stroke, and potentially can increase the risk of breast cancer. So it's important you discuss this fully with your healthcare professional. And then, of course, we have things like the coil. And what you want is a hormone coil which contains at least 52 micrograms of levonorgestrel. Okay, so this will be like the Mirena coil and things like Levocert as well. Okay, and this can be used alongside your estrogen patch, spray, gel or tablet. So they are the different scenarios and they are the different type of progestogens. I hope that helps.